This question is for Dr. Robert. If we are returning to Meghalaya after the 21st of December, do we still have to undergo tests and quarantine?
Well, the protocol dated 27th October 2020 still remains the same. And in case you come after 21st or before 21st December, it still applies. The same entry and exit protocol applies. You need to register yourself online at meghalayaonline.gov.in/COVID, and then you need to either pre-test yourself. If you test by RT-PCR, TrueNat or CBNat, you need to have a test report which is valid within 72 hours of your entry. Or in case you don't have a test report, you can get yourself tested at the entry with minimal charge of about 500 rupees. And regarding the quarantine, that too still applies. If you have tested yourself with the rapid antigen test, the quarantine period would be for about 7 days. And then for the remaining period to complete the 10 days time, you need to self-monitor yourself for any symptoms. And in case you develop any of the COVID-related symptoms, immediately you need to call the helpline number 14410 or immediately intimate your nearest health center. So the protocol is still the same, both the entry protocol as well as the quarantine.
What are the guidelines that I should follow while traveling during this COVID-19 pandemic?
The aspects that I talked about earlier, that I had mentioned earlier, these things are the only things that apply, even in case of travel as well. So understand that you're at risk, understand that your close ones are at risk, understand how much you are at risk for severe disease, and follow the social distancing norms and the 3 C's as told before.
Okay. Dr. Rajiv, this question is for you. Is it safe to use public transport for long distances at this time?
As I had mentioned earlier, that prolonged close contact is something that increases someone's risk, especially if among the travelers there is someone who is infected and maybe that person doesn't know because the person has an asymptomatic infection. So it is best to avoid unnecessary travel as much as possible. Of course, there are requirements. People do need to travel for urgent requirements or emergency. In that case, again, maintain precaution, put on a mask, do not touch any surfaces within the carriage. For example, if you're traveling in a train, try to avoid touching surfaces, or even when I touch the surfaces, try to wash my hands. Carry a sanitizer with you. That is good because in a long distance, especially, water may not be available in all places always. And try to keep that distance between fellow passengers. Ensure that if possible, the fellow passenger is also wearing the mask, so so that the risk is reduced.
Other than the regular protective measures, Dr. Mevan, is there anything else to be considered while planning a trip?
One is, as much as possible, if we're a bit up to date on what is the rate of spread of the disease in certain geographical areas, and try to avoid those places. That might be one additional thing that we take into that may help. So if these local pockets, states in which the incidence of disease spread is much more, as much as possible, try to avoid such travel. Other than that, I think there's very less that we can do. If it is something that you really need to travel for, like for health reasons, to get treatment for a cancer, suppose, which one cannot wait for a long period of time. I think that you should still go and seek treatment for that, and the other things should apply. That's about it.
Yeah, I would really agree with Dr. Meban about the health. You should not. A lot of time what happens is people become overcautious and they think that they would postpone health seeking treatment. which should not be the case even if it is non-COVID, because there are also other causes, other diseases which can produce as much damage, if not more, as COVID. So please do not postpone that. If you are ill, please seek care.
Dr. Robert, is there any entry restrictions while coming to Meghalaya or going to any other state?
Well, the entry and exit protocol dated 27 October 2020 remains the same. For entry, you need to register yourself at the Meghalaya portal, that is meghalayaonline.gov.in/COVID. And then you need to either produce a negative test report which has been tested within 72 hours by RT-PCR, TrueNat or CBNat. And in case you have not tested yourself, you can also get yourself tested at the entry gate through rapid antigen test. And in case you turn out to be positive, then again the state protocol for positive cases would be followed. For exit from the state, there is no such restriction. The restriction would be only at entry. Even if you go out of the state, you would be tested on entry.
What are the formalities one need to look into to visit Meghalaya during this holiday season?
Well, if you go again to the Meghalaya government portal, there is a notification dated 7th December 2020, wherein you need to first get yourself registered using the Meghalaya Tourism app. And then you also need a valid test report, not by rapid antigen, but either by RT-PCR, TrueNat or CBNat. That is the same for all other entries. It has to be tested within 72 hours of entry. And then you will be getting an e-invite with a QR code which you need to produce at the check gate, including your photo ID as well as your test report.
Are there any other necessary documents that people need to produce while entering Meghalaya?
That is the only document. Registration is compulsory, following which you will get an e-invite with a QR code, which you need to produce at the entry gate. And then you also need to produce a negative test report. But in case you develop symptoms during entry, you will be again retested by RT-PCR. Yeah.
Okay, will the COVID test report provided by this other states or other countries, will they be valid on entry into Meghalaya?
Yes, definitely. As I have said, you can get yourself tested under any lab, but on the condition that the lab is recognized lab by ICMR. And as I already said, the test report has to be within 72 hours of entry into the state.
Now, Doctor, a valid RT-PCR test report is mandatory for any tourist to enter the state, which is not more than 72 hours old. What if some tourists want to visit Assam in Kaziranga first and then head to Meghalaya? He or she will not be able to make it within 72 hours of testing.
See, it remains the same again. The protocol has to be followed. If you don't enter the state within 72 hours of your being tested by RT-PCR, your test report remains invalid and you need to be retested again. Yeah.
Okay. If someone needs to travel, etc., he or she needs a hard copy of the test report to produce. How can one get a hard copy?
I think all of the testing laboratories, they do provide a hard copy of the report. So, especially if it's for travel, most of the laboratories who are doing testing for COVID-19, they do provide the hard copy report. At the same time, one can ask from the District Surveillance Unit, the IDSP. They can also provide a hard copy of COVID-19 status for travel. It's being provided.
And in East Khasi Hills, if you want to check your report online, you can go to coronamech.in, and then you can, there is a provision for you where you have to enter your registered mobile number. So you enter your registered mobile number, you get a 6-digit code, enter the code, and your test result would be generated automatically. So you can get that report printed if you need a hard copy of it.
Okay, I think that's about that for this episode. But I'd still like to ask one of our panelists here if there's anything you'd like to add.
Yeah, maybe I could add something. So a lot of the questions we covered is for us to see how we do not get infected, how we can prevent ourselves from getting infected. But it is also important for us to, I guess, understand as responsible citizens of the state and of this country that we should not also be someone who would be spreading the disease. And we need to follow a few things. For example, like masks protect us from getting infected. If we are infected asymptomatically or mild infection, it will also prevent the other person from getting infected because the mask is going to prevent the exodus of the virus from our mouth. That is one thing. And the second thing for us to very importantly understand is that if we are sick, we should please remain at home, remain indoors. If we feel that we have a bit of breathlessness, please seek care as quickly as possible so that the management can be put in on time. And I'm sure that Dr. Mehban will agree with me when I say that this will improve our survival, our chances of not having a severe disease and surviving this.
Well, that's it for today, but don't worry, Meghalaya Answers will be back on our next episode with our experts to answer more questions related to COVID-19. Stay safe.